Good evening. My name is Fahad Razak. I'm an internist at St. Michael's Hospital and a Canada Research Chair at the University of Toronto, focusing on healthcare data and analytics. Today, I'm going to talk to you about steps Canada needs to take to prepare for future health emergencies. But first, as the COVID-19 pandemic approaches its 5-year anniversary, let's start by considering the health emergency we all just experienced. The pandemic was the greatest mass mortality event in Canadian history. More Canadians died of COVID-19 in the past 5 years than in World War I. And the distribution of those deaths was extremely unequal, with catastrophic impact, for example, on vulnerable groups. Consider what happened in long-term care. And critically, this was a whole of society crisis with impact well beyond health and the health system. There were huge disruptions in the workforce. Unemployment nearly doubled in those first few months, with particular damage to lower income and less educated Canadians. Many small businesses closed, losing a generation of wealth and efforts. And we kept our kids out of school much longer than most other countries, with the second highest rate of school closures in the G10 industrialized nations. But remember, we were making decisions with bad options and with limited information. Restrict public movement versus allow the spread of disease. Close schools versus exposing kids to a new virus with unknown health effects. And in this context, there's also much to be proud of in the Canadian response. Among G10 countries, in those first 2 years, we had the second lowest mortality rate. To illustrate how much better we did, if we had followed the US pandemic trajectory on a per capita basis, 70,000 more Canadians would have died in those first 2 years. That means each of us would likely know someone, a family member or a friend, who is alive today, but would have died if we had followed the US course. That is striking. We had the highest rate of COVID vaccination for those first 2 doses in the G10. This means we were able to handle everything from the procurement challenges to the logistical complexity of distributing a vaccine across a huge geography, to educating the public about the value of this incredible innovation. And many of those tough early decisions were made without a lot of political division compared to many other countries. Contrast this to the political divisions in the United States, for example, where COVID mortality rates were 40% higher in red states versus blue states. We did not see that in Canada. These stats only underline what we all know too well. Health emergencies can be far-reaching in their consequence and can fundamentally change society. As we come out of the haze of this time, it's important not only to look back, but to look forward, to ask what elements of our response should be preserved and what could be improved next time. Building on this context, I want to tell you about the recommendations of the Walport panel, tasked to produce the only external federal review of our experience of the pandemic. Over the past year, I had the great privilege of joining 6 other Canadians, including one of our last panel speakers tonight, Dr. Alison McGeer, as we crisscrossed the country meeting with hundreds of stakeholders. Our report was published last month and laid out 12 recommendations based on the advice that we heard. The panel's remit was limited in some ways, thinking about areas such as risk assessment and advisory, and today I wanted to share with you 3 of the most actionable and urgent recommendations. First, Canada should create a risk register. A risk register is a systematic and constantly updated review of risks that can impact health. It then dictates what steps we should take to prepare. Crises could range from pandemic illness to heat waves to a solar fire that knocks out our telecommunication capacity. And the way we prioritize those risks dictates whether Canada should, for example, stockpile a vaccine or build mass cooling facilities. Second, Canada should have a consolidated, centralized science advisory structure. Consider that in 2020, as the pandemic accelerated amid intense pressure on institutions, fear, and social dysfunction, nearly 40 new ad hoc science advisory bodies were created across Canada to respond to the pandemic. Many of these had overlapping mandates and drew on the same small pool of expertise, and many of these left smaller communities behind. This building of the plane as it was being flown is exactly what you would like to avoid in any future crisis. Instead, create that centralized advisory structure now, reduce duplication, and ensure it spans appropriate expertise. Third, we must maximize the use of research and innovation funding. Sadly, Canadian funding for research and innovation on a per capita basis is now the second lowest in the G7, roughly half of what is spent per capita in the United States or Germany. And given these deficits, especially in a crisis, it's crucial to coordinate what existing resources we have. But in the pandemic, we had the disheartening situation where research funding in some instances supported competing studies, making each too small and too slow to have an impact that matched the furious pace of the pandemic. And this has major consequence. For example, if you were critically ill in the United Kingdom, you were 5 to 10 times more likely to be enrolled in a life-saving COVID-19 trial than if you were in Canada. One of the principal reasons for this difference is the UK's coordinated research approach. As we prepared our report, it was striking to see that gaps identified 20 years ago in the SARS-1 report still plague us today. SARS had a massive impact on Canadians, but societies always race to forget the worst, it seems, hastening for a sense of normalcy. 20 years from now, will we say the same for how we responded to the COVID pandemic? And more worrying, what if it's less than 20 years to the next crisis? Last year, we saw wildfires so severe in Canada that we had mass evacuations in some of the most polluted cities on Earth. If you consider infections with pandemic potential, the WHO has declared a public health emergency 3 times in just the last 5 years, for Ebola, for COVID-19, and for Mpox. And right now, we are on the cusp of a potentially extremely worrying breakthrough event with avian influenza, as more and more animals are impacted. A third of all cattle herds in the state of California are now infected and positive. Last year, an avian influenza outbreak in sea lions resulted in a mass mortality event of at least 24,000 deaths. And in the past few weeks, a severe infection has occurred in an otherwise healthy BC teenager without a clear exposure event. Whether a breakthrough mutation of avian influenza occurs, one that allows transmission between humans and sets off a devastating new pandemic, is simply out of our control. Mutations like this are a roll of the dice. Whether climate change accelerates and we see increasingly catastrophic wildfires remains unknown, and much remains to chance as well. That is why, in an uncertain world, I believe the only responsible approach is to act on what we can control, that is, to be prepared. The title of the panel's report that we published is called "The Time to Act is Now." Investments now to allow timely and actionable data on where a disease has spread. The capacity to assess health impacts and system strain in a crisis and to be able to act on those. A coordinated response using the best available science representing diverse perspectives. And rapid innovation in treatment and prevention. The time to act is now. Thank you.